Hello everyone. Today I'll teach you about Graves' disease. Now in Graves' disease there is excessive production of thyroid hormone. The condition can also be labeled as thyrotoxicosis. A very important point to note here is that it is an autoimmune disease. Auto means self, autoimmune disease. There is formation of autoantibodies against the thyroid receptors. Long-acting thyroid stimulator antibodies, they cause marked secretion of T3 and T4 and enlargement of thyroid gland. Because of this, the condition is also labeled as toxic nodular goiter. Okay, and it more commonly occurs in female. So it is an autoimmune disease, basically, Graves' disease. Now, what are the signs and symptoms? In the previous session, we had talked about the physiological actions of thyroid hormone. Very important action is calorigenic action. So when there is rise in the levels of thyroid hormones, there will be increase in the basal metabolic rate. Second feature is exophthalmos. This is a hallmark of the disease. It is very commonly asked, what is the hallmark of Graves' disease? It is exophthalmos. You can see in this figure that there is bulging of eyeballs. Why this bulging of eyeballs occur in Graves' disease? Because of swelling of extraocular muscles and connective tissue, and it causes protrusion of eyeball. You can see in this figure. So physiological basis of exophthalmos, it is a very important reasoning based question that can be asked. I'll answer all the questions in the reasoning based question session, but here you have to memorize that bulging of eyeballs occur because of swelling of extraocular muscles and connective tissue that cause protrusion of eyeball. So there is increase in volume of the intraorbital fat and muscle. Kindly note these points. Okay. Person can suffer from tachycardia even while sleeping. Atrial fibrillation can also occur, which may cause high output failure. It is a very important reasoning based question here. Thyrotoxic patients develop high output failure. Person can suffer from goiter also. I talked previously, can be enlargement of thyroid gland. That's why the condition is called as toxic nodular goiter. Person may feel irritable, restless, insomnia, anxiety, neurosis. We had talked about all these features previously also when I was telling you about the clinical features. It affects neural development and mentation. There can be hyperphagia. Person will eat a lot, but there will be unexplained loss of weight. Okay, despite increase in food intake, there will be loss of weight. Clinically, we can see by asking the patient to outstretch the fingers, we can see fine tremors. Okay, that is a strong indication towards Graves' disease. There can be diarrhea, increase in sweating. Very important point to note here is intolerance towards heat. Intolerance towards heat is a very significant point in Graves' disease. The skin will be very warm and soft. Regarding menstrual abnormalities, there will be oligomenorrhea. It is very important point to note here that patients suffering from Graves' disease, they suffer from oligomenorrhea. Okay, it is called as spillover effect of TSH. I'll discuss it about it in detail in the reasoning based question session. Now that there are two very important signs, Dalrymple sign and von Grafe sign. What do you understand by Dalrymple sign? There is abnormal widening of the palpebral fissure with the retraction of upper eyelid. So it causes a staring look. You can see in this figure, the lady appears to be staring at you. It gives very frightened and staring looks, seen in 90% of the cases. It's a very important sign that you will have to write in your exam. Von Grafe sign. There is lagging of upper eyelid on downward rotation of eye. You can make out from this figure. Upper eyelid, it lags behind during the downward gaze and seen in 50% of the cases. So I had just given you an idea how to attempt a question if Graves' disease is asked in the examination. Start with the definition part or the cause, then clinical features, hallmark of the disease, what are the other features, sign and symptoms, Dalrymple sign, von Grafe sign. So just keep this picture in mind and write about the features. Start from exophthalmos, goiter, come to the heart, arrhythmia, tachycardia, come to the gut, nausea, diarrhea, come to the reproduction part, oligomenorrhea, come to the muscles, muscle weakness, look at the hands, tremors. Over the skin, you can feel sweating. So just keep the figure in mind and start listing the clinical features. Just again a representation of all the symptoms in hyperthyroidism. Just have a look over this. Now what is the treatment part? Heavy dose of steroids and immunosuppressives, they may help. Thiouralins, these are the class of drugs. Propyl thiouracil and methimazole. Now these are the agents that are helpful in the treatment of this condition. How do they help? These drugs, they stop coupling reaction. We had talked about the synthesis of thyroid hormones in the previous session. So these agents, they inhibit the iodination of monoiodotyrosine. Stop the coupling reaction. This is the physiological basis of treatment part. Beta blockers may help. Infusion of radioactive iodine by means of Walsh-Chekhov effect. And when there is excessive enlargement of thyroid gland, then that can cause difficulty in swallowing and breathing, surgery may help. Okay. Now there is another term, thyroid storm, also called as thyrotoxic crisis. It is a severe life-threatening complication, okay, of hyperthyroidism. It occurs when hyperthyroid patients, after stoppage of treatment or in case of ineffective treatment, but when there is mild hyperthyroidism along with recurrent illness infection, it can occur. Clinically, fever will be there, high-grade fever, tachycardia, diarrhea, vomiting, heart failure. You can see all the features over here. Regarding treatment part, we have to ICU monitor the patient, give potassium iodide, Walsh-Chekhov effect again. Antithyroid drugs, we had discussed the mechanism of action, methimazole and propyl thiouracil, they block the coupling reaction. Beta blockers, paracetamol for symptomatic treatment and fluid replacement. That is all about Graves' disease and thyroid storm.